My name is Dr. Michael Smith. I'm an OBGYN physician with Christie Clinic. I'm the immediate past president of the medical staff of Provena Covenant. I'm the medical director for robotic surgery at Provena Covenant, and I'm currently an assistant clinical professor at the University of Illinois. Well, I decided that I wanted to go to medical school back when I was age 12. And when I tell people that, they kind of doubt that some, can you really decide something, that's that important, that early in your life? But I honestly did, and I came from a family that was very blue collar, and so my family didn't have any finances to help me with that dream, and so I joined the military right out of high school, and so I found myself sitting in Anchorage, Alaska, 18 years old, and no money. And I remember very distinctly sitting in a base education office telling a counselor, I want to be a doctor, and her laughing at me. And so that's kind of where I started, but I've actually been able to make that happen and have enjoyed a very wonderful career as an OB/GYN physician. Well, I did a senior rotation in medical school where I did 6 weeks of OB and 6 weeks of pediatrics, and it was during that time that I realized that really OB/GYN was going to be me. It was just more me. When I talk about the Da Vinci robot, I get very passionate because it's made a tremendous difference in my practice. I came into OB/GYN and did my first delivery and my first gynecologic surgery in 1987. The first laparoscopic hysterectomy in the world was done in 1989. And so my career has been all around developing laparoscopic skills. Well, the fact is that the traditional laparoscope has a lot of failings as far as doing these kinds of surgeries. They have a high failure rate. They're very hard on the doctor as far as techniques to learn. From a physician's standpoint, it's almost a no-brainer. And the answers are pretty simple. You spend less time in the hospital with Da Vinci surgery. You have a much less risk for blood loss. Your infection rate is much less. The pain and suffering you go through for an operation is much less. The time back to work is much quicker. And just to give you an example for a particular operation, when you're talking about hysterectomy, if you do a hysterectomy with an open incision, then the average amount of time in the hospital is going to be somewhere between 2 and 3 days. And you're going to be on narcotics for probably about 2 or 3 weeks, and you'll be back to work at about 6 weeks. That's an average, and I've had patients that are in enough pain after an abdominal surgery like that where they'll still be in a wheelchair at 2 or 3 weeks. Now you take that and you do that exact same operation with a Da Vinci, and what you find is those patients go home the very next day. They're off narcotics in 5 days, and almost all of them are back to work in 2 weeks. So I enjoy very much interacting with people and learning about them from their standpoint and what they like. So it's not uncommon for me to discuss, what books you're reading, what plays you've seen, what vacations you've made, and sharing those things with it. I enjoy that very much. I met my wife when we were in high school together. She was actually 14, I was 16. We got married young, and so we've been married 33 years this year. I have a son who's 24, and I have a daughter who's going to be 21 this month. And so I enjoy reading. I enjoy working with computers, and that would be what I'd call my second hobby. I love football, pro football. In fact, we have one of my partners here that we go and see an away game every single year.